Good evening. Welcome to the Kentucky Autism Training Center's Caregiver Summer Series training. My name is Lindsay Eubanks. I am the Family and Community Field Training Coordinator for the Kentucky Autism Training Center. I am also a pediatric occupational therapist and a mom to 2 neurodiverse teens. Enid Hurtado-Stremming also is a part of this summer series training. She had one a few weeks ago on basic communication skills, so you can check that out on our YouTube channel as well. Today's topic is play. We are going to attempt to answer 3 main questions. What is play? What are some barriers to play? And the reason many of you were drawn to this training, how do I play with my child? So what do you think about when you hear the word play? Many times I hear people say toys, fun, and friends. And all of these are great components of play. There are a variety of different ways of describing what play is, but I've found this one to be my favorite. An activity that is enjoyable and undertaken for its own sake, often involving imagination, exploration, and fun. Another definition is to engage in an activity for enjoyment and recreation, rather than a serious or practical purpose. Now, play can be spontaneous or structured. Spontaneous play is play that just happens, depending on what your children are interested in at the time. It doesn't have a specific goal necessarily. And structured play is more guided or directed by a caregiver or a teacher. Both help develop physical, cognitive, communication, and social skills. So, which is more important, spontaneous play or structured play? You will probably hear varying opinions out there about this. I would say both are important and necessary. But for today's training, we are going to focus on structured play. We may do a training in the future on spontaneous play, but for tonight, structured play it is. So what is structured play? Like I said before, it's when an adult directs or guides children's play. Here are some of the ways that can happen: providing resources, offering instructions, initiating or starting the play, joining in with play that's already happening, and modeling how to use toys. For example, an adult might help a child to complete a puzzle that they've never seen before, or play a board game. All of this helps the children learn how to solve problems, and it helps improve active listening. Now, during this training, I am going to be using the phrase play skills quite a bit, and so I wanted to define exactly what I mean when I say play skills. Now, this list is not all-inclusive, but it will give you an idea when you hear that phrase play skills of what I'm talking about. One example is copying simple actions. That can be considered a play skill. Exploring the environment. Sharing objects. Sharing attention with others, looking at the same thing. Responding to others. And taking turns. Those are all examples of play skills. So, we're here because we know play is important, but why? What is the purpose of play? Well, one thing is that it encourages sharing and taking turns, and also taking other perspectives, which is very important socially. Another reason it's important is because it works on fine motor skills, like cutting and writing, coloring, playing with Play-Doh, managing fasteners on clothing. It also helps with gross motor skills, climbing, running, jumping, engaging in sports, and communication and interaction with others. I'll tell you a quick story about my daughter. I want you to picture an adorable 5-year-old girl on the playground during recess. Imagine her just walking around the basketball court while her classmates are having a blast on the jungle gym. Now, to an untrained eye, it would look like she didn't want to join in. But the truth was she couldn't because her motor planning challenges were getting in the way due to her autism. Now, people often assume she didn't want to engage when really her body wouldn't allow her to. She needed some special help to learn how to play on the playground equipment. But as we all know, recess, the teachers are there to take a break too, and there was no one there to teach her. So this really did affect her social development. So her team wrote a goal into her IEP, or Individualized Education Program, to help her engage with her peers on the playground. Her special education teacher started going out during recess to work with her, and she provided hand-over-hand instruction to help her learn how to use the monkey bars and climb on the jungle gym. It was tough at first, but with patience and persistence, she actually did it. This small victory opened up her social world. She went from walking alone to playing with her classmates, and it was amazing to see how just a little support and understanding made such a huge difference. You know, it is such a big myth that people with autism do not want to engage socially. It's one of the reasons I love to tell this story, is to challenge those false beliefs. Now, don't all kids know how to play? Yes and no. I know, it was a trick question. Yes, all children have an innate drive to play. We all engage in activities purely for pleasure and fun. But no, not all children develop play skills at the same rate or have the same interests. Some children need a little extra support to overcome some barriers to play that can come along with autism. So what are some of these barriers to play? For children with autism or autism-like characteristics, their play is often more influenced by how they process sensory information. Sensory information is information coming from vision, hearing, taste, touch, smell, movement information, knowing where your body is in space, knowing if you're hungry or hot or tired. That's all examples of sensory input or information. Now think about when kids are infants. They go through a sensory exploration phase, totally normal development. It includes things like banging items, mouthing objects, intently visually examining items, and the ever popular game of dropping items off the high chair to see mom and dad pick it up. Now, neurotypical children usually move through this sensory exploration developmental stage within a typical time frame. Neurodiverse children often remain heavily focused on the sensory aspects of play. This focus on sensory play could be because their brains are processing sensory information differently, which is a hallmark symptom of autism. It really can be harder for their brains to filter out what is important information to focus on versus unimportant information to ignore. This may lead to a child sticking to just a few toys. They might have a million toys but only play with the cars. Also, it can lead to repeating the same actions over and over. You have a kid that just continually knocks the blocks off the table, or they open and close a door on a Barbie house instead of playing with the actual Barbies. Or they use toys differently than expected. They might also focus on one part of the toy, like spinning the wheels of a car. So as neurotypical children develop, they do start to shift from sensory play to more socially motivated play, because their brains do let them begin to filter out that sensory input to make room for social connections. Neurodiverse children often struggle to move past the sensory components of play to the social components of play. This can look like flicking light switches on and off, banging items, mouthing objects, repeatedly touching objects, spinning wheels, lining up objects, very visual play. And if you'll notice, a lot of these behaviors are forms of sensory play. Now, this does not mean that they aren't interested in social play. It just means their brains aren't letting them get there yet. They want to. They just don't know how. What are some additional barriers to play? Social interactions. Difficulties there can be challenging. Difficulties understanding nonverbal cues like facial expressions, tone of voice, gestures. If you've got a plethora of sensory information coming into your brain, it's hard to focus on a facial expression or a tone of voice when the fan is blowing on you or the sounds are so loud. Also, problems with ideation. That's just a fancy word of meaning coming up with ideas. It's a part of motor planning, and it's defined as generating a plan of action. And it can really impact a child's ability to fluidly perform motor actions, particularly in new situations or with new movements or new materials. For example, I used to work at a therapy clinic, and I would give just a plain shoebox to kids to see what they would do with it. Some kids would use the box as shields or hats or even shoes, but others would get really frustrated because they just could not get flexible in their thinking enough to use the object differently. And that would be an example of difficulties with ideation. Also, differences with pretend play skills can get in the way. That can be due to social communication differences, sensory processing differences like we mentioned before. Abstract thinking can be difficult. And then just in general, changes to routine. They often like to do the same things, which can make it more challenging in novel play scenarios, which can lead to more repetitive actions that are only meaningful to the child, which limits their play schemes. My daughter had a Barbie doll house, and instead of pretending with the dolls like they were having interactions, she would just kind of put them on the roof and then put them down on the ground, and then put them on the roof and put them down on the ground. That was about the extent of the ideas that she could come up with without some support. And lastly, an additional barrier to play is what's called difficulties with joint attention. So what is joint attention? It's when one person purposefully coordinates his or her focus of attention with that of another person. That's what we call joint attention. It involves two people paying attention to the same thing intentionally for social reasons. And this usually is developed by the time children are 12 months old. An example of this would be a parent and a child are at a park. Parent points to a bird in a tree and says, "Look at the bird." The child follows the parent's gaze, looks at the bird, and then looks back at the parent with a smile. Both the parent and child are now focused on the bird and acknowledging each other's attention to it. This shared focus on the same object and mutual acknowledgement of that focus is joint attention. And this is very important for language development. And research does show that play is the primary context in which joint attention skills are taught. Research has shown that preschool children with autism can learn a joint attention skills, which leads to much better language skills for children with autism, in turn leading to better social skills, higher academic performance, and better success in work and independent living as they age. So you may be thinking, okay, so play is important, but my child won't engage with me or anyone to play. What do I do? Well, create some opportunities for joint attention and imitation skill building. Some tips for joint attention, just to keep in mind as you create these play opportunities. Try not to take avoidance personally. Due to sensory or social challenges, many times those with autism do tend to avoid sharing physical space, either because they find it uncomfortable or they just don't understand. It can cause feelings of anxiety, and we have to, as parents, just try to understand this piece. We could even try to start with sharing a space, even just for a few seconds, to show that it can be fun. We never want to force ourselves onto a child in their space, because it will backfire. Another tip is to try to engage when the child is receptive. Try to pay attention to when your child is most accessible and receptive, like during bath time, when you sing, eating something they love, or engaged in a favorite physical activity. You could also try some ideas like encouraging your child to touch you and you respond in a funny way. Like if your child puts her foot up to your face, you could smell it and say, "P-U," and then pretend to pass out. Also, just the simple act of blowing raspberries on them, if they tolerate it, can be a fun way to gain joint attention. And then, of course, imitation skill building games can lead to joint attention as well. Now, imitation, that is when a child is mimicking another, or anyone is mimicking another person. Usually starts in infancy and goes through age 2, the development of it. And it is a key part of development. It helps kids understand how to react to the world and build social and communication skills. Now, while neurotypical children mimic others more naturally, neurodiverse children may need a little more guidance in picking up this skill. You could encourage pretend play, using toys to demonstrate behaviors, or even mirroring your child's actions back to them. Peekaboo games, making silly faces, dancing, and maybe even try to create a pause to increase the anticipation. So if you're dancing and you stop, leave a little space so maybe your child will ask for more. I'm going to show you a short video of a grandmother being coached on how to play with her autistic grandson. And I think you'll be surprised with how simple these strategies are. Anyone can do this. I'm going to click here and hopefully it will come up.
Is very loving and very affectionate. We were blessed with him, and he is on the autism spectrum. I'm Renee Dunn. Marcus, look. I'm Marcus's grandmother. Look. Car? You have a car? He likes playing by himself, and whenever you would sit down with him, he would kind of move away. It's not the game. And he is getting very, very frustrated not being able to communicate. Look, Marcus.
His grandmother watches him while his parents work. When I first started working with Marcus, he was not talking, not saying any words. He had lots of babbling. He wasn't very interested in playing with others. I'm Jenny Sharpless. I'm a speech-language pathologist here at the Kennedy Krieger Center for Autism and Related Disorders. The number one strategy we're going to work on today is just tuning in to what he's interested in and imitating him. So show me how you normally play at home.
Okay, the first thing we would do is we would take them out. Now, if he didn't immediately take something, then I'd give him something. There you go. Very good, Marcus. Very good.
Great. So he was really good at that puzzle.
Yes.
But the one thing that I noticed is that he's playing and you're watching.
Yes.
I want you to be able to be his play partner. So what was he doing with this puzzle?
He was picking up each piece and putting it in.
Yeah. So then you will take your turn and do
So
what?
let him do one and then I'll do one.
Yes.
Let me do. Okay. Yeah, I'm going to put one in. Two? Now you put one in.
Already the look of your play has changed. You were playing together. It looked like you were taking turns. It already looked more fun. One thing is we talked about not asking a lot of questions, not using a lot of generic type language, but looking at a toy and thinking about what's the most important vocabulary we can pick out from this toy. It's just looking at this simple puzzle. What are some vocabulary words that come to mind?
Colors as opposed to shapes.
Okay.
Or if colors were too difficult, I would count because he loves numbers.
Also, we can think of the action words. We put in and we take out.
You want to put it in? Which one? One. Can I do one? Two. So 1, 2. Go ahead. What number is that? 3.
As soon as we simplified her language, she joined him in play. He stuck with her longer and he started saying words, which was amazing. Has he ever seen this toy before?
No.
So he's figuring out that the balls can go in the holes. So thinking about the imitate strategy we did with the puzzle, What would you do to join in with his play? Now let me offer one suggestion. Come around and be more face to face with him.
Okay. I'll be on this side. So now,
Already it changes the look of your play. It looks like you're playing with him rather than just watching him.
true. So now I can take this toy. So we think it has to be something so difficult, and we have to have all this education about autism to work with them. Ready, set, go! Actually, I've learned here with Jenny that it's just the little simple things that you do and simplify the way you think about playing with them that really helps them the most. Can I have a card? Please?
So make sure you have your own. When you imitate him, you don't want to have to take his toy because it's not about turn taking, it's about really imitating. Car! What are you going to do now that you have your own car?
I'm going to try to play along with him. Ready, set,
Go! And look, he is enjoying this so much. You're getting such nice eye contact. He's smiling at you. The next thing I want you to think about is your language. So we already know go is a word because he's saying it. Go! But what other words do you think can you think about with this toy?
car.
Good. Renee, like lots of parents, want to teach their child something new. That's where we get the next part of the strategy, the expand part. But we can think about expanding on our language a little bit and saying car go or go car.
So to hear him say we because he was excited or go because he knew it was time for the car to go down the ramp, it's wonderful.
This bus does exactly what he likes to do. He likes to put things in or on. So we can show him this toy. So make sure your positioning is also on your mind. When you're in this type of position, he can make eye contact with you easier. He can share smiles with you easier.
Off.
You know, especially in this era of technology, there's less emphasis on toys and just good old-fashioned play.
Being in there and taking my turn, and it lets him have fun with it. Thank you.
Join in, do what they're doing, see what they're doing, and it definitely works.
So now I can just play with him and he'll enjoy it, and we'll still be learning. Ready, set, go!
Hang on just a second. Okay. So I love that video because it really does just show simple techniques that anyone can do. Also going to list here just some more imitation type games with some pictures just to give you an idea of how simple some of these games are, like clapping hands, blowing kisses, banging blocks, pounding something with a hammer, patting a baby doll, pushing a toy car, rolling a ball, stomping feet, waving, knocking on doors or tables in a pattern, sticking out tongues, and songs with hand motions. I bet you can think of one. Anyone heard of Baby Shark? Now, this is a handout that we have prepared, and it just reviews some of the techniques that were shown in that video. One being you play with and not watch. Keeping the language simple and relevant. positioning yourself for playing with, using your own toys for imitation practice, and then working on expanding the play. And you can get a copy of this handout towards the end of the session. There will be a link, but also my email will be listed. If it doesn't work for you, you can email me and I can send you a copy as well. Also wanted to give you some more resources that come from the state of Kentucky. The first one is the Team Kentucky Early Childhood Family Guides, and they are super simple but very helpful activities that families can do together. They were first developed in 2003 by a statewide work group, and it serves as a framework to assist early care, intervention, and education professionals, administrators, and others in just understanding what children are able to do and know from birth through about 4 years of age. And these family guides also align directly to the standards and best practices of the Kentucky Education Television's, or KET, program Let's Learn Kentucky. So I put that link there as well. Excuse me. And then the imitation skills reminder handout is there, and the link to that video is also there. Here are the links to the resources. The resource folder is listed there. There's also a survey for this training. The Kentucky Department of Education likes to know how we're doing. And then there's also a caregiver survey, and it is very short. It's only 7 questions where you just click a choice, and it is asking for training needs that the state has, especially caregivers and parents. And we also want to know what part of the state needs the most training. So that is what that survey is all about, because we do have some upcoming caregiver trainings, and we would love to make sure that we are meeting the needs of the state. There's my information, my phone number, and my email. Email's better. I'm not always at the office. And also there's just a list of references of some of the materials that helped prepare this presentation. So I hope that you enjoyed this. And again, if you need to reach out for any questions, also follow us on social media. We're on Facebook, Instagram, X, formerly Twitter. So we often are posting new trainings there as well. And our website, kyautism.org, where you can find more information about KTC and the work we're doing across the state. Thanks for joining us.